Their dream to make me a doctor, a gynecologist, got fulfilled. Not only a gynecologist, I am doing my fellowship in minimal invasive surgery.
In PCOS conditions, what a
In case of polycystic ovarian disease or syndrome, we have to counsel them that they are aware of the symptoms, right? So basic lifestyle modification is the first line treatment.
the cervical cancer is growing up. To patients, how they can save themselves from these conditions.
So for cervical cancer, I think screening is the cervical cancer screening is the basic requirement. So screening. So all the females above the now guideline above age of 30, they should go and get screened vaccination for cervical cancer. They can take at the age of 9 to 25 years. So there are different doses for different age groups. Positive attitude is the preliminary thing that one should have in their life.
Good morning, welcome to another edition of Hello Doc. And with me today is Dr. Sadhana Shah, a gynecologist from Kathmandu. And we will have a lot of insights with Dr. Sadhana. So, Doctor, welcome to this podcast.
Thank you.
And I would just like to take you to your school days, ma'am. And would like to know how you thought of coming into this particular profession and what were the challenges at that particular time and how you have overcome those challenges.
Basically, talking about my school days, I did my schooling from Tarai region of Nepal, and basically, I would like to say that it was a bit backward society. Girls were not supposed to study, but in my context, my parents were broad-minded. My mother and father both were involved in a kind of business, so they wanted me to do my schooling from a boarding school. So I had few obstacles, but due to support of my parents, my mom and dad, I was able to pursue my school from a better place. And after schooling, I was sent to Kathmandu for my further study, so that is their dream to make me a doctor, a gynecologist, got fulfilled.
So, ma'am, as you said, the dream of becoming a gynecologist is fulfilled.
Actually, my parents' dream rather more than me.
Yeah. But now the actual challenges of life comes because going into a 10 to 5 job and being a gynecologist where you can have an emergency delivery at even 2 o'clock in the night. So, how you are managing your work-life balance?
For women, it's very difficult to manage to have a work-life balance. So in a country like ours, where maternity leave is very much limited and working hours is so much high, so it's very difficult. It was very difficult for me to manage my family and work both. But due to support of my family, my in-laws really supported to continue my career as I am now. So not only a gynecologist, I am doing my fellowship in minimal invasive surgery. So I would like to acknowledge my in-laws and my parents who supported me during this journey. So right now, I'm very much capable enough to balance both my work and family as well. And I also want to tell you that I have twins at my home. So it was very much challenging for me to manage both. But still, I must say, due to their support, I'm able to do that.
Because many times what happens, ma'am, now when you said you have twins and you would have missed the moments when your twins started their first step or something like the first day they have made some drawing on the wall. How do you see that?
Um, I missed some of the moment, like you say, first step and all. But still, I think the place where I work, it's also a very cooperative place for me. I don't have to do like 24 hours duty there, but 9 to 4, it's a place I have to work only for 9 to 4. So after that, I'm able to give time to my family, my babies. It was easier because I got support from my workplace as well. So I think all the workplace should support like female doctors, so that they will be able to support like look after their babies, families. Okay.
Coming to your professional life, ma'am, normally to any other clinician, when a patient comes, it is only one patient. But when a pregnant subject goes to you, it is actually two. How you see this and how you manage this situation?
Um, it's like patience that you must have, and because uh, actually I did my residency from Prasuti Griya, which is the largest gynecological center in Nepal. So that place made me like capable enough to look confidently to not only one patient but two or three patients at once. Sometimes I'm gonna have twins, triplets as well. So that place made me capable, I think.
Yeah. Coming to out of pregnancy, ma'am, when you see a female patient, there is a age group of 10 to 15 where there are different problems. Another age group comes around 20 to 30, there are different problems. And the third age group comes around more than 40, the problems are different. How you take care of all these situations and what message you will give like to give to all these three groups to take care of themselves?
Mm, problems might be different, but they come with same queries, I think, in OPD. So, we are capable enough to counsel them, treat them in the way, because I work in a place where we have a group of doctors, we are a team. So, I think we as a team are able to do that. And I want to give message to them that we are
Maybe because a lot of, as you said, different groups are there. Problem is almost same, that hormonal changes are there. You know. But in one group, like you can see the more of prevalence of PCOS. In other group, maybe cervical cancer is more prevalent. So, any particular guidelines or advice you would like to give to all these three groups? What they should do? Like in PCOS conditions, what a
in case of polycystic ovarian disease or syndrome, we have to counsel them that they're aware of the symptoms, right? So, basic lifestyle modification is the first line treatment. So, we need to counsel them regarding the diet modification, exercise, weight loss. So, all these are the counseling that we do. If they are trying for fertility, then we do treat them by lifestyle modification as well as medical management. So we ask them to do don't get harassed earlier. They need to stick up to follow up with us. So in that way, we counsel them.
And any advice you would like to give to patients, because today cervical cancer is growing up, to patients, how they can save themselves from these conditions?
So for cervical cancer, I think screening is the cervical cancer screening is the basic requirement. So screening. So all the females above the now guideline above age of 30, they should go and get screened. In most of the center, it's also free of cost. But we have different modes of cervical cancer screening test, like visual inspection with acetic acid, pap smear, LVC and HPV DNA test. So in some center they can get free of cost also. So in even in Nepal cancer guidelines, they are free. They are free of cost, so they can get screened to prevent the cervical cancer.
So screening is one of the major
And
things.
also vaccination, like
Yes.
cervical vaccination for cervical cancer, available in all of the hospitals, so we can get.
So at what age actually they should take the vaccination, ma'am? Any particular guidelines or only after once it is detected?
No, they can take at the age of 9 to 25 years. So there are different doses for different age groups. So that's the age group.
So in the end, ma'am, any message you would like to give to your family members, to the society, to your friends?
Um, for society, for my one second.
that will, you know,
For the society, females should they were given
yeah,
would always for all the females they should be like they should always get support from the family, their spouse, so that they can manage their work-life balance, and support from the family and spouse is the essential requirement. So I would like to at the end thank my family, my husband, my in-laws, my parents. They supported me throughout this motherhood journey, and so that I'm capable enough to carry on my career and my motherhood at the same time.
yeah, that support is reflecting in your eyes also, ma'am. When you are speaking, that support is coming into your from your eyes also, ma'am. So thank you for coming today for this podcast, ma'am. And as 2, 3 important things you said, the lifestyle management is very important. Screening of patients at the right time is very important. Taking the vaccination at the right time is very important. Very important thing what you said is support of the family is very important, ma'am. And your positive aura, what I was noticing, I think that has created a miracle in the.
Positive attitude is the preliminary thing that one should have in their life, because without that positive attitude, you doesn't move forward.
Yeah.
You will always be dragged backward, because from like residency to motherhood to like gynecologist to motherhood to minimal invasive surgery, I'm getting support from my workplace and my family both at the same time. So I'm able to move forward, I think. That's my suggestion to all the female out there. Like a positive attitude is the only thing that they should have in their life. Thank you.
So thank you, ma'am. Thanks for coming.